Do Africans or black people suffer from depression? If so, how different is our depression from white people depression? My name is Dr. Cissy Atwine and I'm a psychiatrist, and in this video I'm going to be explaining it all. Depression is one of the most common mental health disorders, and it's not just being sad, it's more than that. It's a persistent low mood for most of the day, for most days of the week, for at least 2 weeks. So it means that for you to have depression doesn't mean that you should be sad entirely all the days or all the entire day, but for most of the day and for very many days in a week. For at least a minimum of 2 weeks is what we use to say that this person has depression. It's not just a sadness as well, it's a bunch of other symptoms, 9 of them to be exact, and you must have at least 5 of them for us to say that you have clinical depression. The number of symptoms is what will determine whether it's mild, moderate, or severe. The first symptom is being sad, persistently sad, low in mood, feelings of hopelessness, worthlessness, helplessness even. The next one is loss of interest or pleasure, especially in things that you previously found enjoyable. So for example, you enjoyed reading, you enjoyed maybe going for walks, playing games, and you find that you don't have interest in these things anymore. Or you do them, but when you do them, you don't get as much pleasure as you used to previously. The next one is a significant change in your appetite. So it might be that your appetite increases or it reduces. This change in appetite will also lead to either increase in weight or losing weight. So it's either direction. So you can't just tell by looking at someone and saying this person is depressed, or saying that this person maybe does not look. There is no look for depression. The next thing is changes in your sleep patterns. So you find that either you're sleeping too much or sleeping too little. So this is why it's very difficult. You can't just give a number because everyone's sleep is different. Some people feel very well rested after less hours of sleep than others, and others need their 8 to 10 hours of sleep. So if for you, you find that your sleeping is becoming more than usual or even less than usual, struggling to sleep, then this might be one of the symptoms of depression. The next is loss of energy or fatigue. You find that people who are having depression struggle with energy to do anything. The day-to-day tasks become very difficult. It's like you're walking through maybe mud, or they say trickle, but anyway, let's say mud. You find that everything is a struggle. So that's associated with lack of energy. The lack of energy might happen even after having a full night's sleep. You don't wake up feeling rested and just don't have energy. The next is difficulty concentrating or making decisions. So you find that you might have difficulty concentrating, you might even have memory problems, you keep forgetting things all the time, and this is because depression is affecting your brain, like it's in your mind. So you also find that this part of your brain is also affected. The next is either restlessness or slowed movements. So you find that either you feel super like restless, like you feel like agitated, or you might find that instead you're too slow, everything you feel like you're using extra energy. The next symptom is having recurrent thoughts of death or suicide. So they can be either active or passive. And the difference between active and passive suicidality is that if you're actively suicidal, then obviously you are feeling like you would want to end your life and you're starting to make plans for that. And passive suicidality means that you wish, for instance, if you just didn't wake up, you would be happy if you didn't wake up, or if you wish something would happen to you, or you wish someone else would do something to you, but not that you are intentionally having the thoughts to try and do something to yourself. If you're thinking that the world is better off without you, it's not. If you think that things are just getting worse, it's not getting any better, that's the depression talking. And if you're in the UK, then I'll link some resources below. But if you're feeling like you might be a harm to yourself, then please do consider calling 999, attending an A&E, attending a crisis center, texting the Samaritans, or even calling any of the numbers that I'll put in the description below. If you're in Uganda, Mental Health Uganda has a toll-free helpline that you can call if you feel like you're really struggling and you want someone to talk to, and I'll put their number here as well. In terms of Africans or black people, how different is our depression? Well, for the most part, we tend to have more of the physical symptoms of depression more than the what are called the cognitive ones or the psychological ones. So for instance, we're more likely to struggle with the sleep, with the eating, than with saying someone is sad. Some people don't even have that in their vocabulary. They don't know how to say they're sad, or they can't just say that they're sad, or they don't even realize it. The word depression, for instance, I understand is not even there in most African languages. Comment below if you know what does the word depression in your language mean, or what is depression in your language. Let us know below. So because of that, it's even hard for us to conceptualize it. You'll find that you can easily end up having what are called somatic symptoms. These are physical symptoms of depression. So sometimes people have pains and aches all over the place. They investigate them and they find nothing is wrong. They find like they have unexplained headaches, back aches, joint pains, anything, because your mind converts the pain into something that you can understand, or into something that you're more able to, I think, bear with or explain to people, because it's easier for many people to say, oh, I have a headache here, I have a pain here, than to say that actually I'm feeling a bit low or I'm feeling a bit sad. It's important to remember that just because you have 1 or 2 symptoms of this, it does not mean that you have depression. If you're worried about yourself or someone else, then you want to go and see a professional, and then they can tell you if you have it or not, and then you can start treatment. In terms of treatment, we in psychiatry have 2 main forms of treatment, which is either medication or like tablets, or talking therapy, which is usually by psychologists. But also another part is the social factors, which is very important to consider, is that there could be a root cause of this depression that is actually some social problem, that if that was fixed, then someone's mood starts to lift. So it's really a multifactorial thing to try and look around for your individual case. Where could this depression be coming from, and what could be the best like treatment for you? If you found this video helpful, then share it with someone else, because they might also find it helpful. And if you liked the video as well, give it a thumbs up and make sure you're subscribed so you don't miss my videos from me.